Well, hello, and welcome to our webinar about automating the fulfillment of medical record requests. My name is Tom Seco, and I am the Business Development Manager for DAS Health. Before we get started on today's webinar, I want to cover a couple items regarding the webinar itself. Just to let you know, this webinar will be recorded, and then two, everyone's phone will remain muted throughout the entire webinar. So if you do experience audio issues, please use the chat box to let us know so that we can resolve them. And then three, I also want to let you know that there's not a one-size-fits-all solution for the ideas that we express in today's webinar. I would also like to introduce Joe Scholes. Joe is our Product Solutions Director, and he and his team developed the solution that we are talking about today. This is an agenda I put together for today's webinar. I'll take about 90 seconds in the beginning to introduce you to DAS Health. Then we'll take you through a couple slides to lay the foundation for what you're going to see in the demonstration of the product. I'll turn it over to Joe, and he'll take you through a demonstration of the ChartGuard OnDemand solution. And at the end of the presentation, we'll answer any questions that you have. As you think of questions, you may type them in the questions area of the webinar control panel, whenever they occur to you, and then we'll answer them at the end of the presentation. So who is DAS Health? We are a leading provider of health and IT management solutions. We are a trusted consultant to many physician groups, hospitals, and healthcare systems across North America. We have 20 plus years of experience with NextGen. We have a broad and deep portfolio of services. We have over 200 employees in the company, and we have worked with over 425 clients that use NextGen.
Hey, Tom, the slides didn't kick in. If you want to restart the share.
Oh. There we go. Sorry about that. Our passion is to work with our clients to improve patient care, work with our clients to enhance the patient experience, and work with our clients to maintain a financially healthy practice. Our mission is to improve the healthcare experience by delivering the highest value health, IT, and business solutions to our clients. And in the 20 years, we've developed a strong relationship with NextGen, and we'll continue that relationship in the years coming forward. So the bottom line is we're here specializing in NextGen, keeping our focus on you, and we're here to help and serve you in any way that we can. This is a quick look at our solutions and services model. I'm not going to go into each area, but I will point out that we have divided into three areas: practice management, information technology, and patient care. The product that we're talking about today to automate the fulfillment of medical record requests falls underneath the productivity products and enhancements area. And that's the area that Joe heads up. So before we get started, I'd like to take you through a poll. And if you could take a minute and answer some of these three poll questions. The first one is, how many hours do you typically spend in a week fulfilling medical record requests? Do you spend less than 5 hours a week, 5 to 10 hours a week, 11 to 20 hours a week, or more than 25 hours a week in fulfilling medical record requests? I'll give you a couple more seconds. Close it out in 5, 4, 3, 2, 1. Let me share that with you. So, a third of you, or 2/3 of you, say 5 to 10 hours a week, or 2 hours a day. And a third of you say 11 to 20 hours a week, or 3 to 4 hours a day. Second one is, what is the volume of medical record histories that you fulfill in a week? So do you fulfill less than 10 in a week, 11 to 25, 26 to 50, 51 to 100, or more than 100 in a week? I'll go ahead and give you, close it out in 5, 4, 3, 2, 1. So almost a little more than 70% say 11 to 25 per week, or 3 to 5 per day. And then the remaining 26 to 50 or 51 to 100 per day. Thank you. And the last question is, what frequency do you typically fulfill your medical record request? Is it a daily task for you? Is it a weekly task for you? Is it a monthly task for you? Or do you do it immediately upon request? So immediately as you get the request, you are immediately working on it. Give you a little more time on that. So we'll go ahead and close it out in 5, 4, 3, 2, 1. Thank you. So 86% say it's a daily task, and the rest do it immediately upon request. So everybody does it basically within the same day. Well, thank you very much for doing that. Okay, so back to the presentation. So as I mentioned earlier, everyone's phone will remain muted throughout the entire webinar. And if you do experience audio issues, please use chat box to let us know. And I think you'll find with all of the products that we develop here at DAS Health in Joe's group, there's basically 3 common themes that go with each of the products. And those common themes that are, 1, we want to make the job easier. 2, we want to make the process more efficient by streamlining it or automating it. And then 3, we want to save people time and effort. And I think you'll see that in as we go through, Joe takes you through the demonstration. But why do practices and health centers use ChartGuard OnDemand? Well, they use it to automate what can be a very time-consuming manual process. You receive requests from insurances, from attorneys, from medical, from individual patients, and even from internal staff. And here's some of the reasons as to why you receive those requests. Basically, I would say a majority of them come from insurances, and either for audit purposes or review purposes. And sometimes you get a request from insurance where they're asking for the medical histories for 50 to 60 patients in one request. And we've even talked to practices that have said that they can get a request for up to 500 patients from an insurance. So it can be a very large request that comes in that can take an extremely amount of time to fulfill this request. So the request that came through to automate this process was done to help free up people's time so that they can work on other tasks as well. This is a slide that shows the statistics that we've taken over the past year and a half, 2 years from organizations with regards to their process of fulfilling medical record requests. You'll see the percentages here. They do not add up to 100, and the reason they don't add up to 100 is because we receive multiple responses to the same question from within the same organization. So we recorded all the responses, and that's why you see more the percentages to be more than 100. The left-hand box is how frequently the organization fulfills medical record requests, and just to kind of see how you lined up, on your responses. You can see how you line up with everybody else. It's a daily process for quite a few organizations, as you said it was for you. The center box is refers to the number of hours the organization spends on fulfilling medical record requests. And you see here how the percentages spread across the various practices. And again, you can see how you measured against with your response today. And then the right-hand box is about the volume of medical record requests that the organization fulfills on a weekly basis. And again, you can see how you rate or match up with the rest of the practices that responded over the past couple of years. So basically, how does the software work? Well, it's a NextGen Add-On program. It gets installed in your environment. It has an interactive user interface that allows you to choose to do fulfill medical requests for a single patient or for a range of patients. You can control the depth of history either by a range of encounter dates. You can do it by financial class. You can do it by a particular provider. It generates a PDF file, so it makes it very easy for you to transfer that medical record to an individual or to the requesting organization. It makes it easy for people to read the file. Makes it easy to bookmark the file as well, so you can easily navigate up and down throughout the file to get to the information that you need. It also can run against a report database, so it doesn't hit against production database and slow down production. So with that, I'm going to turn it over to Joe, and Joe's going to take you through a demonstration.
Okay, great. Thank you, Tom, and thank you everyone for joining us today. We're going to go ahead and switch over to my demo machine, so your screen may flicker. Use the control panel for the webinar if you're having any problems seeing the presentation or it doesn't look like things are matching up, and we can go ahead and try stopping and restarting the sharing, as that tends to help. So you should be seeing my NextGen environment now. I'm going to take you through how ChartGuard OnDemand works. As Tom mentioned, this was created in response to the fact that generating medical record requests required not just manual effort in getting the data, but it had to come from several different sources, various reports in NextGen, medical records, and then someone had to collate all that together and hand it off to the requesting entity or person. So what we opted to do with ChartGuard OnDemand is give you a tool where you can set all that up, and through a series of mouse clicks, have the medical records for the population you want with the data you want generate in the background. So I'm going to take you into the user interface for this and show you how it works. Now, one of the things I'm going to do before I get started talking about the user interface is I'm going to start some charts for my test patients generating in the background. And this actually is a great feature because it shows how you can still keep using your workstation while these are running. All right, so I've submitted those for my test patients to be created. Now, how does this work? What's really going on here? Well, in the upper left is where you can pick your patient or patient population. So we can get exact hits by first name, last name, date of birth. We can match it to a number in NextGen, person number, medrec number. So if you have particular individuals that you're looking for, maybe it's an individual request that you want to get processed, you can go ahead and pick those out person by person. If it's a request from a payer or a legal entity or a government entity, typically you're concerned about who is the provider and who is the insurance, some combination of those or one or the other. And then you're concerned about what dates they came in for visits, right? Give me all people who were Blue Cross Blue Shield that came in the first quarter of the year. So we can go ahead and pick a financial class in that case, and we can pick the range to have a visit. And then when we have patients that hit within that range, we can say, you know what, give us the prior year's worth of data for that. All right, so we give you different ways to slice and dice this to come up with the population that you're looking for. Now, when you hit find, the population will show up down here, and you can just select all if you want, or you can go through and pick and exclude the people that you're looking for. So that's what's going on in the upper left-hand corner of the screen, is we're looking for particular people whose medical records we want to generate. The other piece of the puzzle is, what do you want in those files? We're going to generate a PDF file for each patient that I'll show you in a little bit. And part of the dilemma that we're trying to solve is right now you're going to multiple places in NextGen to print different information and collate it together. Well, what if you could just tell the system what you want for each patient in that file? And that's what's happening on the upper right here. Right now I'm using the default preset, but you can set up other presets for what you're looking for. For a patient, it might be everything. For an insurance, it might be limited data. For legal claim or workers' comp, it might be other stuff. But you see here in the list the different items from NextGen that we can pick out. We can also pull in documents you've generated and documents that have been acquired into ICS Document Manager. In fact, on these, you can go ahead and set the depth of what you're looking for, because a lot of times in Document Manager, the documents are just tied to the patient, not really to an encounter. So this gives you a way to limit what goes in there. Because remember, the whole point is to be able to put the information in the PDF file that you're actually targeting and not have too much or too little information. All right. Additionally, if you were looking for financial data, you could have the account summary in there, sticky notes. All these things are all up to you. And again, you can set a preset based on each constituency that's doing a request. So again, legal might have different options than a person, than a payer. So while I've been talking, these charts that I requested down below have been running. So I'm going to go ahead now and get a history on these and see if they've been processed yet. And I can see I talked long enough where they've all fortunately been completed. So now I can come in here if I want and preview these, and I'll show you what these look like. And again, this is the information according to what I selected for my preset and what was available in NextGen. I'm going to go ahead. Oh, my PDF reader is giving me a little bit of a headache here, so let me go ahead and relaunch it. It's just a standard PDF file, so it's going to go ahead and launch whatever your PDF reader is. In this case, I'm using the Adobe PDF reader. And what we'll see at the top is we get a cover sheet with the patient demographic information, employers, responsible parties, all that good stuff. So again, when you're handing this off, not only will it be in the file name, which will be last name, first name, date of birth, but that first page they go into, they can confirm that it is who they want that they're looking at. And then if we scroll down, or if we were flipping through paper, we'll see the various grids of information about the module data in NextGen, and then we'd get down into documents. The good news is if they're using this electronically, we go ahead and bookmark each section automatically as we generate the file, so that you can go ahead and skip around and get to the data that you're looking for at that particular moment. So this bookmarking happens automatically also as part of that process. And these, of course, match the different categories that we've picked in our setup and our preset for what's going to be in these PDF files. Now, you can obviously view these individually, but if you're generating hundreds of them and you need to go ahead and put those on a encrypted drive or upload them to a secure portal, you can make available the folder that these get generated into. So I can go out to that folder and I can see, here's my PDF files that got generated. And as I mentioned earlier, last name, first name, date of birth, I can go ahead and drag these either onto that encrypted drive or to that website with the secure upload and deliver them to the other party that's requesting them. If it was for a particular patient, I could obviously print them to paper because it's a PDF file. Or if they had a drive that they wanted it put on, I could go ahead and put it on their thumb drive and hand that off to them, and they could take it wherever they're going next. Maybe they're snowbirds and they're leaving the area for a while and just want an update on their medical record. So this is how ChartGuard OnDemand works. This is the value proposition for it and the problem we're trying to help you solve, which is just being able to simply pick the population you want, pick what you want in the chart, and have the computer go ahead and do the work for you, so it's not tying you up with these cutting and pasting and collating type projects. You can get those requests out faster and get on to the other work that many of us have to do. I'll go ahead and turn it back to Tom now to wrap up, and then we'll take your questions.
Okay, thank you, Joe. And so you just saw how you can automate the fulfillment of medical record requests, and now that you have seen the solution and how it works, you can probably imagine how this solution can save significant time for the people who do the work. Realize each of your practices and health centers operate a little differently with the processes that you have in place. So as I mentioned in the beginning, we know that there's not a one-size-fits-all solution. So we encourage you to contact us, and let's get together and talk through your processes, talk through any issues that you might have, and see how this solution can be used to save your staff significant time and effort. So with that being said, we'll now answer any questions that you have, and if you could enter them into the webinar control panel, the questions box, questions area of the webinar control panel, we can answer any questions that you have. So here's a question, Joe. Is there any logging done in the system of the patient history being generated?
Yes, there is. There's logging both done by ChartGuard OnDemand, and we also write to the PHI log in NextGen. In fact, even if you're running the chart generation against your report database, we will still write to the production PHI log, so you have that out there, because obviously you tend to overwrite your report database each night when it gets updated. So that's two spots where we'll go ahead and log that for you.
Another question. We have a connection to our radiology department of our hospital. Can we get access to those images?
ChartGuard OnDemand is focused on the NextGen side of the equation today. So if you have information flowing into NextGen from your radiology system, whether it's coming into a document manager or whether it's flowing into the actual chart, that information we can obviously pick up. If it's information that's off in the other system, then unfortunately we can't get to that information. So it's one of those things we can talk to you about, maybe a customization to be able to pull parts of that information over. But the best case would be if there was some interface bringing it over either as documents in the document manager or some type of discrete interface.
Is there any logging in the system of the patient history being generated?
The patient history itself, yes, will be a combination of what's in the upper right and then the patients themselves. It will not go down to the granular level, but you'll have an idea from the chart preset on the upper right there and the patient logging.
Another question. We are hosted by a third party. Does that pose any issues?
We can work with you and your third party to go ahead and get ChartGuard OnDemand installed so that it'll work in that environment. So we have a number of clients that are self-hosted and hosted by third parties.
So one other question, is there access to billing information if we need it?
Yes, there is. As I was showing, we do have the account summary in there and we do expand that out. So you'll have the historical billing record from the account summary.
Okay, so if there aren't any other questions, we can go ahead and end the webinar. But if you do have questions as you think about it, today or tomorrow or later this week, you see our contact information up here on the screen. Send us an email or give us a call and we can answer any questions that you have. Again, if you'd like to have a more in-depth discussion about the solution and how it would fit within your organization, again, contact us and we can go through that with you. So thank you very much for attending our webinar today, and have a great rest of the afternoon.
Thank you, everyone.